Welcome back again to my channel. My name is Queenette and I'm a 300 level nursing student. Immediately after 200 level as a nursing student, that is when you will go for your first clinical posting. So a week to clinical posting, everybody was so excited. Now we didn't know what to expect, we didn't know anything. It was our first time. Everybody had sewn his scrubs, I was so happy because nursing is what I've always wanted. Watch my videos. I'm going to watch my videos to see how I told you I wrote so many jam. I even studied microbiology. I served before I even came to nursing, so I didn't have any fear whatsoever. I didn't even, like, in my heart I was just going to, and that's very wrong. You see, one lesson you should pick out from this video. I know as a nurse you are meant to be caring, you are meant to be compassionate, you are meant to be loving, but don't overdo it because you are actually doing more harm to yourself than good. And that was what happened to me. Oh God, I'm still being very emotional. So fast forward, we went to the hospital, we got introduced. That's going to be a totally different video. So let me just fast forward to when I went to my first ward, or no, it was not my first ward, my second ward actually, the second unit or second ward we were posted to, because we did 4 wards. So this ward is pediatric, emergency pediatric unit, not just pediatric unit, but emergency pediatric unit. On this fateful day, we were all with a particular nurse. We were 4 actually. We're learning tube feeding, everything about tube feeding. So when we came out, one of the nurses was like, "Where are you guys? There a lot of things have been happening here, and you people just hid yourself and you were there learning something." Then he just resuscitated a patient, a little baby girl just now, and she wanted us to, partake in it. She wanted us to learn a lot from it. This patient was lying down. This patient is a little baby girl of about less than 2 years. I'm not sure of the age. So the matron was like, "You come." And I don't even know why this matron actually had this connection with me. Like, if she needed anybody to do something, she would call me. I needed to take a sponge the patient. The patient is running temperature. She wanted me to manage the temperature so that it will go down because the temperature kept rising. So I called one of my fellow nursing students, and then we got everything necessary. And then I did the tepid sponging. I was very gentle. I was very, very gentle and loving because this is the first patient in this ward that I'm actually touching or coming in contact with. And the fact that the patient was a baby, I was just so very gentle. I took the patient like my own baby because I have a toddler baby girl also, maybe a little bit older than that baby. So I just put myself in the shoes of the mother of this baby. Okay, so I just assumed that, if this was my baby, this is how I would love the nurse to be so gentle. So I was gentle, I was doing everything properly. And then, once I take the sponge, I take the respiratory rates. I checked the respiratory rate, I checked the pulse, I kept recording everything. And then this baby, I noticed the baby was just looking directly into my eyes. And then I was like, I was trying to communicate with the baby to, get the baby more conscious, or trying to get her to be responsive. The mother was outside just praying. The mother's sister, I think, or the auntie, I don't know, was close by, also praying. So while she was praying, my heart was praying. Like, in that moment, I got so connected to this baby. If that baby could actually speak or respond to me at that point, I would have told the baby, "Don't worry, you are going to be fine. Don't worry, I promise you are going to be fine." Don't ever make this kind of mistake before, where you promise a patient that the patient is going to be well. Later, I don't know what happened. The condition just worsened over time. Sorry, I'm not giving complete information about what happened to the girl, but a lot of things started to change about the girl, and the condition was just deteriorating rather than becoming better. The doctors will come, they'll check, they'll do this, they'll do that. The oxygen man came, and then they began to administer the oxygen. And this baby, I was just praying in my heart. I was like, "No, you're joking, right? You're joking. No, all of this is just joke now." Once she gets oxygen, because even her oxygen saturation was quite low, very, very low for a baby. And then once the oxygen was administered, long story short, this baby just started going right before my eyes. So my male colleague that was there, I just looked at his face. I thought I was the only one connected to this baby. I didn't know that even he too was connected to this baby. Like, his face completely changed. It's just that he's a man, you know. They will say men, you're not supposed to show emotions. Like, this my male colleague was trying so hard to be strong. I've never tried to restrain myself from crying more than I did that day. The father of the patient had already gone to go and get some drugs that he was asked to buy. The auntie of the girl was asking me, like, what is wrong? It seems she's not breathing. Why is she not breathing? So I was just holding it in. She was asking me. The only thing I could just gesture to her was like to speak to the doctors, because the doctors were actually there before I came, and I just felt like the whole superpower thing I was feeling before coming to this ward. In my heart, I was feeling like God has blessed me with so much power that once I just come in contact with any patient, no matter the patient's condition, the patient will be getting better rather than getting worse. Funniest thing was that I could not even move from that place I was. Even when all the doctors were coming to do whatever they could to bring her back again, I could not move from that particular spot I was standing, because like I was in shock. I was in serious shock. I was like, my goodness. I was like, what? How can this happen? I watched this child go through all the stages, like all the stages before the child drew her last breath. Like, and while all of this was happening, this patient was looking straight into my eyes. Like she kept looking into my eyes. Like the only thing I could read from my eyes was, do something, my body is failing me, do something, help me, help. I could not help you. I could not help you. I could not do anything. Fast forward, the girl did not make it, you know. So the mother came. I could not even look at the mother in the eye. So I was still standing there, right there, like a soldier standing there. And then the father came, and then the father just came in with the drugs. He didn't even see the wife, the mother, because the mother was in one corner, and funny enough, she was not even crying so loud. She was trying to, I don't know. So the father just came in and he was like, what happened, where is the girl? And then still I could not talk at that point. I just wanted the parents, I just wanted the parents of the child to deal with the actual nurses and the doctors. So I also gestured to him to speak with the nurses and the doctors, and then the doctors were trying to calm him down, to tell him, okay, this is how it has happened, we've lost her, and we tried all the best we could. And this man, I just saw like a rush of anger and disappointment on this man's face. The man actually ran in with a lot of hope, like, okay, I'm back with the drugs, can we proceed, and the man just came and met his baby girl, just his beautiful baby girl, just there on the bed. And the only thing he did was he just went and touched the baby girl's stomach. He just touched her like for like a few seconds, and then he just hissed out of anger, and then he just walked out of the room. And that whole scene, it broke me. I don't think I have cried as much as I cried that day from during the time I had my baby girl. That was like 3 years ago. I don't think I've cried like that. So after everything, the metro still met me. I was like, okay, there's nothing we can do, that I should take off her cannula because she was cannulated. I held the baby girl's hand, and then I was trying to, you know, remove the whole plaster and everything, and it was just taking time. I don't even know why this was taking so much time. It was even pissing me off that the plaster was just too much. And then I was trying to peel it gently. I was trying to be as gentle as I can, you know, just to be so loving. And in my heart, I was just wishing this baby girl all the best. I was just wishing her all the best. I was just praying, you know, sending good volitions, goodwill, and wherever the baby girl is looking at me, if her spirit was looking down, if her spirit was looking at me at that point, I just wanted her spirit to be smiling, to see that her nurse actually loved her and actually wished her well. And you know, I took off the cannula, and you know, it was bleeding. Even after I took out the cannula, I had to stay there. I had to like put cotton wool there to like apply pressure. And that reason I was actually the one doing some of this was because I was on gloves. In the hospital, you do not attend to any patient whatsoever. As far as you are going to come in contact with the patient's fluid, any fluid whatsoever, you have to be on gloves. Okay, after I finished, and then the matron was like, that's all, there's nothing else we can do. I just excused myself. Like, my body was so heavy. I excused myself. I just, went into the ward, and then some of the nurses were like telling me, well done, but look, I was just looking for one corner to just pour out my heart, and then I just went to, the nurses' changing room side, and then I just burst. I cried. Like, I cried the whole pain, even though the pain is still in me. I cried out. Like, I feel like this thing is going to be with me. Like, it's a memory that it will be so hard for me to erase in a short while. It will be so hard for me to erase this memory. This memory is going to remain with me for a very, very long time, because even after the nurses gave me orientation, because after I cried, they let me cry. They let me cry. Even one of my colleagues, a girl, came to console me. To console me. I'm not even the parent. She came to console me and everything. They let me cry, and then after I finished crying, and then when I came, so the nurses were like, are you done crying? Like, they were so, some of them were trying to like make me laugh, and even me, I just knew that it's like, I just had to laugh, because I didn't want the thing to spoil my entire day or my entire week. So I was just trying to smile. And then one of the nurses, the deputy matron, was like she understands. She totally understands what I'm going through. These are the things they also go through. These are the things they see. I should try my best not to be too attached to a patient, because if a nurse gets too attached to her patient, look, you as a nurse, I don't think you can even last. I don't think you'll be able to last a month in the hospital if you get too attached to all your patients, because you get attached to this patient and this patient doesn't make it. You get attached to the next patient. Like, if your heart keeps being broken into different pieces, you're not going to have a heart anymore. And then you too as a nurse, you won't. My goodness. So other nurses came. They gave me orientation. They were they spoke to me, they gave me orientation on how to behave, how to protect myself, how to avoid such kind of situations, and then how to be able to handle a patient no matter the condition, and do the best you can for that patient without being emotional, to the point that if anything bad happens to the patient, you would now be affected. Because if you are affected, if one patient demise affects you, how are you going to be able to care for the other patient? Which is true, because at that point I went to cry. What if I had other patients to attend to? What if I had medications to give? What if I had many procedures to perform? How would I have done that? So yeah, they actually, oh my god, I miss that word. I really, really miss that word. And after that day, I started to train myself to put myself in the patient's shoes, or the patient relation's shoes, but then I'll protect myself. Okay, so even the matron came to tell me that the only thing that what she does for her to be able to still continue living as a nurse and living as a sane human being is that if she knows that she has done everything the best that she could for that patient, and the patient still doesn't make it, she will just have that assurance that she did the best. If they didn't do the best that they could for the patient and then the patient still died, that's when she will feel guilty that maybe the patient died because she did not do everything that she could have done. So yeah, that's my experience. And each time I remember that whole scenario, like, I just get so teary, because it has to do with babies. Please, if you are a mom, dad, anybody, if you have any sibling that is a child, that is still a little child, please do not joke with their health. Whenever you notice some of these babies cannot talk or cannot fully express themselves, the moment you notice them having temperature, do not joke with their temperature, because apparently the story I heard was that the patient was even a referred patient from another hospital. The patient had been running temperature, very high temperature, and they didn't take the patient to the hospital in time. Before they got to the hospital, the baby was already unconscious, baby was convulsing. A lot of things could have been happening to the baby. I did not specifically check the patient's history or check anything, because I just don't even want to know anymore. So the patient was referred from another hospital to our hospital, and then that was when the whole thing happened. So yeah, I don't know if there's anything you've learned from this video as a nursing student, or anybody plans to be a nurse, or even a random person that has nothing to do with nursing. There are a lot of things you can learn from this video, and this is just going to be the end of the video. I thought to share. So I'll see you in my next video. I can't believe I cried in this video. Oh my goodness. Now video is over and the tears is over. God help me, God help me. Can I even specialize in pediatric at all? Yeah, so overall I enjoyed the entire week in the pediatric. I got so attached to the ward, not the patients, because there were other patients too that would come, and then after like a day or two they'll just get better, and I'll be like, what, you are better and you are going home? Oh my God, I was so happy. So I experienced a lot of happy moments more than the sad moments, so that it made me enjoy the ward even more. And yeah, I'll see you in my next video. Bye.